So my name's Chris Smith. I'm the sales director at Wax Digital. So we're here today to talk about one of our clients, which is a foundation NHS trust, quite a large one, and we'll give you some details on how they've saved literally millions of pounds in implementing an e-procurement system with Wax Digital. For those of you that don't know anything about Wax Digital, this is really the only sales pitch you're going to get from me during this presentation. Wax is a UK company. We've been around since 2001. We've around 240,000 users in 34 countries. We provide spend management software. So we provide eSourcing solutions, eSourcing and contract management. We provide purchase-to-pay solutions, or we provide a full source-to-pay solution, which is everything combined into one holistic product. We've been independently rated by Gartner as a #1 UK provider of e-procurement solutions and top 5 globally for e-procurement systems as well. And that's independent for purchase-to-pay and independent for e-sourcing as well. I'm sure most of you have seen the stories or read the news about the challenges, not just in the NHS, but in public sector. Obviously, costs are rising, spending is going up, and there's a real drive and initiatives to reduce cost and get savings. I think in the recent discussions or forums that have been out there, and the government initiative is looking for around a 20 billion saving over the next few years. And obviously, one of the key drivers of that is to implement an e-procurement system. So the government initiative or the review that was done is all about obviously reducing costs. It's about better procurement, better value and better care, I think, are the key strap lines that they're talking about. It's about better management and control of spend with a real focus on collaboration and competition within the supplier base, and having what they're calling procurement champions as part of that process as well, which is fundamental to the results. So our client, County Durham and Darlington NHS Trust, it's one of our major clients. It's a big client of ours. They've got the full source-to-pay system, so 9,000 users within the source-to-pay software. It's across 10 NHS trusts, community care, GPs, and they've got around 8,500 suppliers in the system. So it's a big implementation serving around 600,000 people, and they've been rated as one of the top 5 hospitals in the UK. Sorry, top 40 hospitals in the UK over the last 5 years. So what were the initial challenges of County Durham and Darlington NHS Trust? So first of all, when we first started talking to them, they had an old e-procurement system. So one of the good things for us is they knew about e-procurement. They'd been using a previous version of eProcurement or eProc, but it was coming to the end of its life cycle. Their contract was coming to an end. It was old. It had limited capability. They'd not had any software upgrades or updates in 7 years, and it wasn't future-proofed. The other key things were 95% of the buying was being done by 3 of the 10 trusts. The other 7 weren't really doing a great deal of buying. And there wasn't really any standardisation or standard ways of purchasing across the NHS Trust. They're all doing their own thing and doing it their own way. So there wasn't really a centralised procurement function and a real centralised way of actually doing anything. So what were their goals? Their key goals were about releasing working capital. So they wanted to reduce the amount of stocks that they were carrying and faster turnaround of orders. They wanted the full source-to-pay system. So they wanted to run the e-sourcing tenders. They wanted to have contract management. They wanted the requisitioning through to invoicing. They wanted the system integrated. So they wanted it integrated into Oracle, to the NHS supply chain, to GHX. And they wanted it to be compliant for OJU, and they wanted to be able to roll it out quickly as well. So they were looking for a commercial off-the-shelf product. So from a Wax Digital perspective, we rolled out a phased rollout. Each phase was a big bang in that respect, but it was ultimately a phased rollout. So we started in 2009 with the P2P implementation. It then moved on to e-sourcing, tenders, auctions, then the supplier portal, contract management, through till December 2012. One of the key parts of the process from Wax to County Durham and vice versa was we ran a very comprehensive set of workshops back in 2009 that included people from finance, AP, procurement, IT and the admin side. There was a very clear communication program internally within the 10 trusts to get stakeholder involvement, get engagement from key people within the NHS trusts. And the training was fundamental. So the training was done in 3 stages. We initially did training of around 200 key staff within the NHS trusts. There was then another set of training exercises for hundreds, if not thousands of staff, which were done over a period of time by Wax and internally as well after we trained their super users. It was then ongoing after that, so there was more one-on-one workshop-style training. There was WebExes. So a real comprehensive training program to get the users up to speed quickly and fast as well. So what was born out of that? What was born was a system called Cardia. Does anybody know what Cardia means? So it was named by the trusts, and this is one thing that we do as a company. We give the client the ability to name it, to brand it themselves. Has anybody ever heard the term Cardia before? Well done. Did you? Exactly. That's exactly right. It's the Roman goddess of health. So that's just a quick look of the front end portal. You see, it's very Amazon style. Lots of quick link buttons for requisitioning throughout the system. It's very easy to use, as you can see. It's very clean lines. It's branded accordingly. It's a very nice, clean, simple, easy system to use. So the purchase to pay side, currently there's around 600,000 catalogue items in the system. We've got integration into Oracle ERP. We've got integration for the NHS supply chain, GHX, and we've also got punch-outs to Coots for the finance, accountancy side, and Blackwell's for the medical books. Since the initial implementation, it's obviously expanded, as you can imagine. This is just on the P2P side. There's now around 800,000 catalogue items. We've done a full data migration from the eProc system, unified product coding across the solution, standard products. So if they want to buy a pen, they can only buy 1 pen. There isn't a choice of 10 pens. It's 1 pen from 1 supplier. So even though it sounds like there's a lot of catalogue items, it's very, very standardised, driven and focused. And the bulk of the ordering that they actually do is mainly through the NHS supply chain.
Is that coming through the catalogue then?
Yes. Yep. Yes, it does. Yep.
You're capturing all your data in one place?
Absolutely. Yep. So the user only sees the P2P system. They don't see what goes on behind the scenes. So since then, they've implemented eSourcing as part of the solution. So you've got OGU compliant eSourcing, e-tendering, e-auctions, auto-grading and auto-scoring. They've got a very clear process that they follow as far as purchasing, buying. So high-value non-catalogue items are sent to a specific buyer, which fundamentally follow this process. So if it's under £5,000, it goes through usual purchase process. If it's over £5,000, it goes to buyer review. So if it's between 5,000 and 19,000, they go out for 3 quotes. If it's 19,000, so 20,000 to 113, it goes out to a local tender. If it's over 113, they'll follow the full OGU tender process. And then once they've gone through the process of the auction or the tender, all the data is fed back into the purchase-to-pay system. So you've got huge benefits from sourcing, not just obviously from savings. Obviously, you can get a lot of savings from running sourcing and tender events. You've got standardised documents, standardised process, level playing field for suppliers, compliance and full audit trail. You've got transparency of spending being fed back into the P2P. You've got push and pull data into the P2P, and you've got full audit functionality by running it through the eSourcing solution. So since P2P eSourcing, they've implemented supplier portal, so product catalogues, account maintenance, remittances, PO flip to invoices, and they've also integrated the contract management side. So from a WACS perspective, what we ultimately provide is the full solution. Now you can take it modular. We do have lots of clients that start with eSourcing and contract management. We have lots of clients that start with purchase to pay, then add eSourcing and contract management. And in the case of Cardia and lots of other clients we've got as well, they take the full solution. So everything's starting from your eSourcing down in the bottom left-hand corner, through your requisitioning, your approvals, placing your orders, reporting, goods receipting, inbound invoices, invoice matching, all fully integrated into the ERP system. So some of the results that they've achieved since implementing the system, now bearing in mind we've got a client here or a user that was mature as far as they'd used eProcurement before. So they'd had 7 years of benefits of using an old eProcurement system. So we've effectively pushed them onto the next level. So they're currently processing around 15,000 documents per week through the solution and around 5,000 invoices per month. To date, and it was only a week or so ago, they've now processed 1 million orders through the solution, and they've gained about £5.4 million worth of savings. And all these figures are quoted direct from County Durham and Darlington. Some of the savings, 1.2 million on printer cartridges, trauma products, 233k, smaller savings on agency staff and insurance services. Again, these are real savings and real data from County Durham and Darlington. These are not figures that we've just made up for the purpose of the presentation. So a short video from Sue.
Something that every organisation should do because it brings so much benefit to all healthcare organisations. Particularly and first and foremost, as Finance Director at County Durham and Darlington Foundation Trust, there was compelling rate of return that we could achieve by putting e-enablement in. Not only did it allow us to create significant efficiencies in back office functions in finance and supplies, but it enabled us to free up working capital, which is so important to us as a foundation trust. And as we move into the more difficult financial climate, it will be more important to trusts and NHS organisations up and down the country. However, e-enablement, you would be silly to think that it's only the financial benefits that create the significant opportunities. From a governance perspective, there's significant benefits that can be had for patients. As we move into defining more and more carefully our pathways and defining clinically precisely the products that we want to use with any particular pathway, what e-enablement allows us to do through the cataloguing is to have control that we've never had before around ensuring that those patients on those pathways receive the products that our clinicians have selected and not variable products. And that's just so powerful in terms of clinical governance, and is something that we're looking at in terms of our patient safety agenda, and is bringing real advantage to the front line, because quite simply clinical staff can't order because products that aren't on the pathway because they're not available to them in the catalogue. And I think that that compliance aspect is becoming more and more important to organisations as the clinical safety and the clinical quality aspect of the care melds with the requirement to deliver efficient, effective services, and therefore it brings an awfully powerful clinical argument to put e-enablement into organisations.
Again, more than happy to speak to anybody about what they've done, how they've done it, how they've achieved it. So if you're interested in having some conversations with them, just let me know, and I'm more than happy to introduce you as well. One of the great things out of all of this is they've won 2 awards. So they've won the Customer Service Excellence, or Award for Customer Service Excellence, and a Charter Mark Award as well, again for Customer Service Excellence. And they're also shortlisted for an award, a Procurement Leaders Award, very shortly as well. So future developments for County Durham. So one of the key things now, they've got total visibility of spend and products that are being used as far as that spend. They're now looking at patient costing. So looking at integrating into other systems so they can actually track that patient costing, and obviously scanning and controlling of stocks as well. So we're looking at integrating those solutions into the purchase to pay system as well. So now they've got to this stage, they're looking at pushing the boundaries and moving it forward as well, which is great. So what was excellence for County Durham, and what were the key things for excellence that they were looking at? So when we speak to them about what their view of excellence was, it's very much knowing your organisation's requirements, but not just the requirements, but knowing what the goal is or the aims are at the end of the process. Engaging internally with your stakeholders, people who are actually going to use the system on a day-to-day basis, in procurement, in admin, in finance, in IT. So make sure you get everybody engaged in the process if you are looking for a new solution. And integration, integration of supplier management. So your internal integration with your ERP system, your external integration with the NHS supply chain, GHX, and any other third-party products as well. And that's one area that, as a company, we are very strong with, as you can see from the results here. So a question for you guys, not expecting you to answer it here and now. It's really, what's excellence for you and your organisation based on some of the things that you've seen here today. It's not always just about savings and driving savings. It's obviously a key part and one of the things we're always looking at. But what else is there? Is it compliance? Is it audit trail? Are there other things within your organisation that you're striving for? And really, the big question to ask yourself is how close are you to it, and can we help you to get there as well? So some of the clients that we've got, and again, various different types of views on excellence and what their goals were. Again, savings is one big part. But if I look at some of the brands that you see there, obviously we've talked about the NHS today. If you look at top right-hand corner, Seva Logistics, one of their real key goals was they were looking for a system that can be rolled out globally across 34 countries, all centralised out of the UK. They've got that by using our system. Other organisations like WWF, for example, they've got our source-to-pay system. One of the key things for them was supplier management. So they wanted to work with suppliers that had the same views and ethics around what they did as an organisation as well. So that was key for them. And various different stories across many of those different types of organisations. Again, you're more than happy if you want to speak to any of our clients who have implemented P2P or source-to-pay systems. They're more than happy to share their experiences and views on what they think as well. Any questions? That's it from me. We've obviously got a stand upstairs if you want to come by. We've got brochures, we've got handouts. I can share contact details with you for County Durham. I can give you my business card. I've got business cards here if you want to email me afterwards. I hope you've got something out of this. As I said, this is a very big client of ours, again, who is more than happy to speak to you, to reference, talk about their experiences, and Malcolm and Sue are more than happy to do that. So, by all means, if you've got any questions, otherwise that's it from me.
Thank you.
Thank you.